Hi, hello. Welcome to Nest Insider. This is Chapter 10, Healthcare. What can I say about the health system here? Honestly, I have not met a local who understands all the ins and outs. Are you interested in what health cover you need? Well, it heavily depends on your visa type. Is healthcare free? Shall I choose the public or the private system? Do you know why a bulk billing medical center is good for you? First of all, what is a bulk billing clinic? There are so many questions, and as long as we are healthy, fit, and strong, we do not really care. But what if you have an emergency, like a jellyfish bite? It is good to be informed in advance and act quickly when needed. One thing is for sure, Australia has high-quality healthcare providers. The hospitals are well equipped, so you will be in good hands. This chapter will give you an overview of the system, explains the differences between private and public services, and what you need. I added a few health stories from real people with detailed breakdown of costs for you to understand what to expect. Let's start.
Chapter 10, Healthcare. In this chapter, we will talk about the following topics. Overview of the Australian health system. Visas and health cover. What do I need? Is healthcare free? Health stories and out-of-pocket expenses. Overview of the Australian health system. This topic is super important. Why? Let's imagine you are not feeling well and need a doctor's advice. Or you are generally healthy, but you have just got injured. No one wants to become sick, but unfortunately, it can happen to anyone. When you need to act fast, there's no time to study the system, where to go, and understand fees that can be hefty, from a couple of dollars to thousands. This chapter will give you a brief overview of how the system works in Australia. It will help you save time and money when you have the need to experience healthcare here. This topic is gigantic, and the whole book could be written about it. The Australian healthcare system is complex, complicated, sometimes it's a maze. It took us many years to get the picture, or at least some parts of it, but still, after more than 10 years living here, I cannot say that I fully understand all the nuances. Let's break it down to digestible pieces. First of all, learn this number 000 or 000. If you have emergency, please call 000. I would classify the system as a hybrid one. We have Medicare, which is the government-funded system. Money to run this system comes from federal, state, and local governments. The public system includes public hospitals, community services, and other health organizations. Taxpayers also contribute through the Medicare levy, 2% of your wages, and the Medicare levy surcharge, additional 1 to 1.5% of your salary. You do not pay Medicare levy surcharge if you have private health insurance. If you are an Australian or you have a PR visa, you are eligible for Medicare. Additionally, there are 11 countries in the world that have reciprocal health agreements with Australia, and their citizens, when they come to Australia, can also enjoy the benefits of the system. These countries include Belgium, Italy, the Netherlands, UK, Malta, Finland, Ireland, Norway, Sweden, Slovenia, and New Zealand. I will touch on what happens to other countries' citizens and what cover you need when you arrive, or better to say, before. Hang on. It's coming in the next section. Health spending in Australia is high, about 10% of the GDP. That means from every $100 that is spent on various services, $10 are spent on healthcare. The other part of the hybrid is a private health system. Usually, when someone is sick, the first port of call is called primary healthcare, that is a GP, general practitioner, or a GP clinic with many GPs. Don't be fooled, however. GPs are not necessarily free. The right answer is, it depends. More on this later. The private system comprises of private hospitals, specialist health services, for example, a dermatologist, dentist, cardiologist, and pharmacies. The next table aims to give you guidance and comparison in this super complex system by listing the differences and benefits of each scheme. This table compares public and private system, doctor choice, emergencies, hospital rooms, elective surgery wait times, ambulance services, and complex conditions.